Much. I know that from the beginning of this crisis, all of you watching at home and all of us certainly in News 4 have marveled at the courage and the dedication of our healthcare providers. But what's it like? What's it really like to spend all night on a COVID ward treating patients? Tonight, a Brooklyn nurse working in critical care gives us a first-hand view of the bravery and anxiety in a hospital critical care unit. The I-Team's Chris Glorioso is live at Essex County, New Jersey with her story. Chris?
Chuck, this nurse works with patients who have the worst prognoses. These are people on ventilators who are completely dependent on hospital critical care. We asked her to make a video diary, and it shows her courage. It also lays bare her authentic fear.
This is too much. I don't know how much longer I could do this.
Sheena Tanis is a Brooklyn critical care nurse who agreed to show us what an overnight shift is like, treating only the worst COVID-19 patients. These New Yorkers are not just on ventilators. Many are on dialysis and countless medication drips, too. She's the one watching them all night.
It's 10 p.m. I'm heading in to give medications to my COVID patients. It is so hot under all this PPE, but it's important that I keep myself protected in order to take care of the others.
Tanis works at Brookdale Hospital, hard hit by COVID, with a refrigerated box truck out back. It's a temporary morgue. Because Brookdale sits in an economically depressed community, Tanis says many of her patients have the risk factors that go along with that community: asthma, diabetes, and heart disease.
It is 11:15 and I'm still in the room with the patient, doing dialysis. I'm managing drips, managing the ventilator. It's not easy.
It's not easy to manage these critically ill patients and not easy to manage one's own anxiety. During her overnight shift, Tanis told us there is constant worry about the risk of nurses becoming infected themselves. They don't dare take off PPE.
This is the sweat that came off of me while I was in this room in my plastic gown. It is extremely exhausting.
For the rest of the night, the Brookdale critical care floor was too busy for Sheena Tanis to record more video diaries. She didn't press record again until the next afternoon as she got home to her 2 kids.
It's 12:19 and I just parked my car coming home from the shift. My face is breaking out from the mask. I look like I've aged 20 years in 2 weeks. This is too much. I don't know how much longer I could do this.
Sheena Tanis is the mother of 2 children with asthma, and I cannot say this enough. She, like healthcare workers across our region, cannot leave that fear and anxiety at work because they are afraid of bringing the infection home, so they disinfect themselves before saying hello to their families. And I should also point this out. Sheena Tanis is probably asleep right now because she works the overnight shift. She's going back tonight. Reporting live in Essex County, New Jersey, Chris Glorioso, News 4 New York.